Welcome everyone who's just joining us online to our CPE Speaker Series. I think I recognize a lot of the names online, but just for those of you who might be joining us for the first time, our Center for Practice Excellence is based here out of the Leslie Dan Faculty of Pharmacy here at the University of Toronto, which is where I'm based today. And we focus on pharmacy education and training, research, and practice and innovation. So our monthly CPE Speaker Series, where we gather each month, is really where we get to learn about and learn from each other to discuss critical issues impacting the future of healthcare and pharmacy more specifically. So just before we get started, as I mentioned, I am based on the land at which the University of Toronto operates here today. And I want to acknowledge this land. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. I recognize that this meeting place is still the home to many Indigenous peoples from across Turtle Island, and I'm particularly grateful to have the opportunity to work and learn on this land with each of you. Today, we are very lucky to have Lachmi and Sandra joining us today to share some of their recent work. So for those of you who typically join us, Sandra and Lachmi will be speaking for about half an hour or so, and then we will save the remainder of the time for audience question and answer at the end of our event today. So just for a few quick housekeeping items, just to remind everyone that our sessions are recorded and posted online on our Faculty of Pharmacy webpage and also on our YouTube channel. I will just ask that you keep yourself muted while the presentation is taking place, but feel free to have cameras on if you'd like. And then I'll just ask that you kindly put any questions or comments for Sandra and Lachmi into the chat, and then we will get to those at the end of their presentation. So I would like to just take a moment to introduce both Lachmi and Sandra. Lachmi Singh is a distinguished academic and administrative leader with a rich portfolio of expertise spanning academic planning, quality assurance, equity, diversity and inclusion, and legal education. She currently serves as the Director of Academic Programs, Planning, and Quality Assurance at the University of Toronto, where she provides strategic guidance on academic structures, governance, and innovation, all in compliance with provincial quality standards. Sandra Mejia is an associate professor teaching stream at the University of Toronto's Leslie Dan Faculty of Pharmacy. Sandra has a long history of teaching, research, and service, and has recently been nominated for the AFPC Award for Innovation in Education related to her work developing virtual pharmacy simulations. These simulations have been used within the faculty's Medication Therapy Management 2 course, or MTM2 course, within the PharmPath program, and also by the Ontario College of Pharmacists in one of their online training programs. Together, Lachmi and Sandra are co-leading a project investigating the nature of kindergarten to grade 12 and post-secondary partnerships to support underrepresented students' access to and success in the health sciences. We are so happy to have you both joining us today. Sandra and Lachmi, I will pass it over to you now.
Thank you so much, Annalise. Well, thank you for the opportunity to connect with this community and also to share our work. Our topic today, increasing diversity across healthcare sectors and the importance of early educational intervention. We endeavor to share our journey today of how we got here to be doing this work, a little bit about our approach, very pragmatic, having a learning mindset and seeing every interaction, whether it's with a student, a partner, a potential collaborator, as an opportunity. Our work from the very beginning was grounded and has been grounded in diversity and equity and collaboration and cooperation. And our work continues to evolve. We see this as ongoing evolution. We work with intentionality and a growing understanding of how important it is to make early interventions. And so I'll tell you a little bit about our journey thus far. Okay. There we go. So our partnership and educational research journey really began, I think, in 2019. Lachmi and I were fortunate to be awarded an eCampus Ontario grant. And this grant was to develop 3 pharmacy practice simulations with the goal of making the work open-coded, adaptable scenarios that could be picked up by other educators across Ontario. The focus, when we put our heads together, we saw a gap and we thought interprofessional would be a good place to start and really make these focused on highlighting scopes of practice. This was because at the time, scopes of practice were still evolving, and as we know, that continues. So interprofessional scopes of practice, pharmacists and pharmacy technicians. These were to be low fidelity simulations designed to be patient-centered and case-based. And our own focus, we decided we wanted to incorporate diverse patient demographics. And so this, I think, was really sort of the very beginning that has led us to today. Then the pandemic happened and everybody has their story. But you know, what happened for me personally is it placed me in U of T and UHN's collaborative vaccine clinic. I was working there as a pharmacist, but I was also making my own observations, not only of the patients, but the team, my own family and community, and thinking about the importance of trust, you know, when we started talking about vaccine hesitancy and how diversity within professions and cultural competence really became blatantly obvious to me that it really mattered. And so through those experiences and also through my work developing the COVID vaccine module, we started to think, well, if we're to make a dent and think through, perhaps we need to reach students earlier. Perhaps we need to be tapping into and committing to working early, making interventions, educational interventions earlier. And that led us to the APA 2021. We saw Access Programs University Fund opportunity. And this grant was to create access and pathways to increase post-secondary school. And this aligned with our thoughts about pharmacists and pharmacy technicians working to scopes of practice and getting out there and reaching students early about post-secondary education. And so we collaborated again, and this time with the intent to reach high school students. So moving to younger, and we continued to broaden our network, and you'll hear a little bit more about our partners. But it was going beyond pharmacy technicians and pharmacists to include other universities, other colleges, STEM fellowship. And through this work, we developed 3 more simulation scenarios, but this time sort of targeting high school students. And we began planning our experiential day. So our experiential day happened in 2024 and just recently in March in 2025. And we were fortunate to secure the McKesson grant, and my colleague Lachmi will tell you more about that work, that we've leveraged our past experiences to date to now grow our network and grow our work. So implications to healthcare workforce. Well, you know, through our work and our learnings from the pandemic, we observed that health inequities exist. That was clearly evident, and people seek care differently. And, you know, diversity is important and critical across our workforce. And when we thought about workforce, we were thinking about regulated health professionals. We were specifically focused on pharmacists and pharmacy technicians. But, you know, my understanding has grown around the health workforce and There's, informal caregivers, and there's caregivers within that support health. But our work was grounded in the regulated health professions first. But with that said, going back to my every interaction is an opportunity, we don't know how these interactions may be contributing overall to the healthcare workforce, and planting seeds in students early to think about healthcare as a potential career option. We also know that diverse teams make for better health outcomes. And so, if we think about that quintuple aim for better health care and improved economy that Health Canada aims, our work and our teaching of these students is aimed at ultimately enhancing the patient experience and advancing health equity. So challenges to doing this work, specifically in health science curricula. Well, this is where the importance of seed funding is highlighted, because all of this work we had small grants, and then a little bit bigger grants, and then another little bit bigger grant. But each time we had funding to start the work and to be able to begin to develop these educational artifacts that could live and be redeployed and used for different levels of students. We also recognized that partnership is key. And so we partnered with Seneca College, Centennial. We partnered with the University of Waterloo, individual pharmacists and pharmacy technicians, STEM fellowship. But network building was always sort of key to our work. But also, if you think about funding, we have the funding to begin, but then we need funding to sustain the work. And we wanted our work to not be just one-off things, but we really have worked to ensure that we're building sustainability, because that is also tied to trust. Like, we can't be just going to people and working on individual projects and then things fall apart. But we've been, making a concerted effort to continue to build trust and build our network of people involved in these projects. And this has led us to working with early educators, and that's our current work. And thinking about, going back to that trust, thinking about like reciprocity. What is this work, and how does it support the missions and initiatives of others who are engaging in this work as well? Because we're asking lots of people, we're asking lots of them. We're asking for not only for them to share their time, their expertise, their lived experience, and so we have to find ways to work with people and value and do what is valuable for them. These are some of the challenges, and I think some of the things that were great opportunities for us, or things that have helped us, have been the fact that our own faculty has built EDI into the academic plan, has supported our work in kind and in spirit, and sometimes with also seed funding, and allowing for the space for the work to happen. So just going back to partnerships, the significance of partnership, we recognize that collaboration cannot happen without these partnerships. And so we've built these bridges to do the work, but also to nurture these partnerships over time and ensure that they're reciprocal. So for example, we collaborate with STEM Fellowship, and they have worked with us, and I'll share a little bit more about how that has happened. And we also want to maintain those relationships with other initiatives that have similar missions and visions. So STEM Fellowship is one example of that. And beyond partnerships, like more formal partnerships of work, we also see students as our partners, and students have been involved in this work from the very beginning. And students not only are usual pharmacy students and pharmacy technician students, but students in the health sciences, computer sciences, and even through one of our partnerships, a graphic design course and student organizations. So some of the things that have resulted from our work, so the video testimonials. So we started through the APUF program to feature personal journeys of authentic, engaging stories of the professions. So not only the pharmacy students and pharmacist professionals, but also pharm tech and pharmacy technician students who identify as Black and Indigenous. So representation was very important, and these video testimonials support engaging students within these communities. And what you see here is a screenshot of some of the scenarios that resulted from our APUF work. So these were scenarios where we had co-developed topics for high school students that would likely be of interest to them, like therapeutic topic areas. We co-developed with pharmacists and pharmacy technician teams. We had consultation to ensure that the topics, the scenarios were engaging to high school students, and that they profiled collaborative work between pharmacists and pharmacy technicians. You can see that we had diverse representation within the actual modules, and we worked with STEM Fellowship to disseminate these modules. So these modules live on our LDFP website, and students can have access to it, but they also were actually actively disseminated through a Google Classroom through STEM Fellowship's extensive network to high school students. Students then, once they completed these modules, they could register for the experiential day that we held in March 2024, and then this year in 2025. This is a snapshot of sort of an overview of the modules that students would see. And we used good pedagogical practices, backward course design, where we considered, well, what are the learning outcomes that we want the students to come away with? What are some engaging activities that students would find interesting? And we incorporated accessibility features and opportunities for the students to connect not only to resources, but also to assess their own learning in the process. So the whole idea was that this should be fun and engaging and profile the profession so that we would have interest in pursuing hopefully pharmacy practice, but the health sciences as well. And there's an example of, knowing that the students don't have an extensive background in pharmacy practice, we made the questions straightforward. There were some true false. There were other types of questions as well that the students could engage and go back to and test their knowledge in a fun way. And that there would also be the answers as well provided. So I spoke a little bit about the experiential day. And so this was an in-person experience at the faculty for high school students where they would have practice, a pharmacy practice experience in our practice lab, and then they would have a lab activity that was compounding in our pharmaceutics lab. They would have a campus tour with our students, and they would hear an inspirational speaker from the community speak about their journey to pharmacy. In 2024, our goal was 40 students and we had 39 attend, so that was a success. We had focus groups after the event and students gave us rich feedback that we used in 2025 to incorporate into the programming. And in 2025, our goal was 60 students and we had 61 attend the day, March 15th. And here are a couple of representative quotes. Overwhelmingly, students said that they enjoyed the days and they learned, which was our goal, and fun was our goal. And you could see that, our goal of planting seeds and engaging learners to consider the possibility of choosing a health profession, and more specifically a pharmacy health profession, was ultimately, an important goal for us. We continue to look at what's next for us and how do we continue to have students gain interest in professions, and specifically PharmPath. And so one of our recent partnerships is with the summer camp that Kathy Vu will be leading. And we're going to be offering some scholarships to offset the cost of 5 students attending, with that idea of promoting equity and continuing to encourage students to see pharmacy and to see themselves in pharmacy. And so with that, I'm going to hand over to moving away from our journey to our current focus and handing over to Lachmi.
Thank you, Sandra. I hope everyone can hear me.
Yep.
So as Sandra alluded to earlier in her presentation, our team was fortunate to be the recipient of several grants over the last several years. The most recent being a 2-year McKesson EDI grant to run from 2024 to 2026. And as part of this work, we wanted to examine the question, what do partnerships look like between kindergarten and 12 and post-secondary that can increase students' access to and success in STEM for the health sciences? So just a little segue here for a second. I don't know if anyone's ever looked at the way the government, our provincial government, sometimes awards funding or classifies STEM. So STEM is made up of sciences, technology, engineering, and maths. And the health component, the health sciences are treated separately from STEM, but yet we all know that that inspiration, that Sandra said, that seed, the excitement that stems for a career in the health sciences is ultimately born from a love of sciences and the other STEM areas. So additionally, we wanted to see how health and science can be more integrated into the K-12 system. And in the current Ontario K-12 curriculum, for those of you who may have children who've gone through the system or have gone through the system yourself, you will probably recall that health is covered under physical education. It is not covered in the sciences. In fact, when we did a curriculum mapping of the programs across K-12, it is not until grade 8 that students start to learn about cell systems and linking that to this in the science curriculum. So, and I recall this from many years ago, having gone through the system myself. So it shows us that things have not evolved in this area, which is an opportunity for us. We see the gap and we recognize the opportunity. So another example is through the primary grades. So anywhere from kindergarten to grade 2, students are learning about the importance of hand washing. They're having the dental hygienists come in to talk about the importance of brushing your teeth. But again, the link to health and what that means for our bodies is it's more task oriented, the activity, rather than linking it to the health sciences. So when we look at this, when we've done our research and we've looked at these areas, what we are seeing is that these are opportunities for where we can partner to perhaps give more support to our K-12 school system to be able to close those gaps within the education system. I think another challenge that we have identified is that the two K-12 and post-secondary, as I'm sure you're all aware, are governed under two separate ministries. So K-12 is the Ministry of Education, and post-secondary institutions is the Ministry of College and Universities. Again, resources and priorities are allocated from two separate ministries, which then filters down into how things are enacted and in what way. So in embarking on this project, we very much wanted to take an academic approach. We wanted to do a scoping review to see what literature already existed in this area, specifically what has been written about partnerships between K-12 and post-secondary to inform our work. We focus on certain geographic areas, the United States, Canada, the UK, Australia, New Zealand, because we really wanted to look at comparator countries who may be experiencing some of the same issues within their curriculum. So with the scoping review, the scoping review drew over 4,000 articles with our keyword searches. We were able to narrow that down to only 72 papers that mention partnerships or collaborations. And even fewer of those deal with cross-sector collaboration. So when I say cross-sector, I mean from one level of education to another, having that type of partnership. Most partnerships were across schools that are at the same educational level. The themes that emerged from this scoping review for us in terms of what are some of the challenges with maintaining these partnerships. They are vulnerable to funding, and Sandra's spoken about funding. They are vulnerable to political climates, again, alluding to the difference, the different ministries that are governed. So sometimes a new government may come in that has different priorities. They are vulnerable to personnel change, at both levels. And as we're all aware, post-secondary institutions and K-12 have very different academic cultures and in our mission and what we are so it's about thinking, how do we overcome those hurdles in order to establish a successful partnership? Next slide, please, Sandra. So following the scoping review, our next step was to, we wanted to hear firsthand from teachers who work in K-12 and teach in STEM subjects. And we wanted to hear from post-secondary educators about their thoughts in this area. So we put out a call across our institution here at U of T and across different school boards. And we formed a series of working groups to generate ideas for partnerships between K-12 and post-secondary that can support students' knowledge about health sciences, their access to education, and how we can achieve success in STEM and health sciences. So out of the groups, we organized them into the following areas. We gave in a ranking system, our participants had the opportunity to rank their preference of groups, and we tried to assign everyone to at least their first or second preference. So the groups were mentoring, experiential education, professional development, curricular initiatives, and community outreach. I think there are many more we could have probably drawn from, but these were the pillars that we think were foundational in order for success to emerge. We tasked the working groups by giving them a template in order to generate their ideas for cross collaboration. The first couple of meetings really were just about sharing their experiences. We didn't ask anything of them in terms of a deliverable. It was just really to discuss what is your experience in grade 5? What is your experience in grade 9? Speaking to someone from the Faculty of Nursing, what is your experience teaching the health sciences at the post-secondary level? And then from there, we start to talk about ideas. Okay, so if we recognize these gaps, we see an opportunity, how can we work together? What resources do we need? Are they financial, giving of one's time, expertise, and how can we make that sustainable? How do we keep this going so it's not a one-off, it's not something that's offered once and then it fizzles away? It was also about these groups making connections with each other. We are but one pathway. If I can borrow from our theme, PharmPath, we are but one outlet. There should be other ideas which stem from this, and I think that's the foundation of our work: how to build out a framework that can then be adopted. It is transferable. It can be used across multiple networks to be able to do this type of initiative, whether it's on a small scale, a faculty member who goes to help out with a science fair, to something that's more innovative or more long-term, right? So I think the important thing is making those connections. Like, where do you start? Who do you go to, right? And then our path forward is to gather up all of these ideas, and we are hosting a conference, an educators conference in September of this year at the Schwartz-Reisman Institute. The conference is free for our attendees. And again, it's a bigger forum to have this kind of discussion. We really want the conference to be interactive. We will have a keynote speaker, but it is really to put out some ideas, to some thinking points, and then to generate discussion amongst the attendees about what a framework can look like and what do we need to embed in that framework for success. So with that, I will pass it back to Sandra.
Thank you, Lachmi. So what's next for us? Well, Lachmi alluded to the work that continues, and we are looking for ways that we can continue this work, but engage others in the work as well. Not only leading up to the conference, but ongoing as well. So we've embedded this code so that if you have interest and want to reach out, please do so, because our work will evolve and continues to evolve, and we are even thinking about how we can reach more students reach students that we not only to come to us, but perhaps us going out to students. And so we see APPE students and educators as our future collaborators as well. So if you're interested, please reach out. And I'll put that code back up just in case if anybody else wants to see it. But I just wanted to say this is our contact information. We look forward to having answering your questions. I see some questions on the chat. So perhaps, Annalise, is this a good time to go back to the QR code, and then we can pause the lecture.
Yeah, that's great. Thank you so much, Sandra and Lachmi, for your remarks. I think the QR code is great. If there's a URL, we could pop that in the chat. And I'm also happy to circulate that after today's event, just with different groups. But thank you for including that. And thank you for your presentation. We do have a question from Anne. So thanks, Anne, for popping this into the chat. Anne's question is, how are you going to measure success given, yes, the long duration between kindergarten to grade 12, then perhaps a first post-secondary interaction or experience, and then application to pharmacy?
Excellent question, Anne. Sandra, maybe I'll go first and then, yeah. Okay, so that's a very good point. How do we measure success? You're right, it is a long road. Even when I think about a program like pharmacy, that is a second entry undergraduate program, there is that gap between high school and students thinking about, what they want to do after they've already done 2 years of another program at university. So it certainly is a challenge. The way I look at this is that we have to take it in steps. And I think that's why dividing the approach into those pillars. So how many, I think success is measured by the number of opportunities that are provided, that are increased to allow post-secondary institutions to partner with any of the K-12 divisions in aid of this work, right? So I think about it like, is it mentorship? Is it, like I said, going into a science fair or just doing, I think about our one of the wonderful professors at pharmacy, Dr. Dave Dubins, he runs these wonderful workshops where he makes science fun. And I think, like just events like that. But I think they can be a one event, but it has to be something that is continued. And I think that is the challenge because like I said, personnel will change from year to year, time constraints will change, financial resources will change, but I think we have to make a commitment to make this a priority. As a post-secondary institution, we are always mindful of our recruitment numbers and students coming through to apply to our programs. And in order to keep that momentum going, we really also have to do some of the work that goes into that. And I'll pass it to you, Sandra.
Yeah, I was going to say, I think we have not yet built out our program evaluation plan because we're thinking now in broad brush strokes of how we're going to be planting these seeds and continuing to plant these seeds. But I think, if we look at other programs, investing early and being mindful early makes a difference in the long term. Whether, the thing that came to mind was Tennis Canada. Canada's not producing any tennis players, but when they started to invest early and young into opportunities to build skill, all of a sudden now you're seeing, these tennis players in representing Canada. So something, we're thinking sort of in those big terms and taking baby steps forward, Anne. Good question.
That's fantastic. I think that is probably just a good general life approach as well. in addition to for this work.
Yeah.
I had a question. Just I know of your great partnership with STEM Fellowship. I know that that's been quite fruitful. I was curious just to hear some of your reflections or insights on the process of building partnerships, um, and ensuring that the overall vision for something and values that are guiding the work are aligned with those partners. Just if there's anything you've learned sort of in your various partnerships with people to get this work off the ground.
Actually, one thing, I'll let you take this, but I guess I'll just share one thing that Annalise, I'm aware of, and also always worried, are we doing enough? Are we doing too much? Is that communication, maintaining communication with our partners, and that ongoing communication, but meeting the needs of the type of communication as well, and the timeliness of the communication. And certainly that's a piece that I think, to foster a good relationship, you have to maintain communication, and partnerships happen, maintaining partnerships, that's an important piece. Some of our building partnerships, it's been an interesting process. It's been through connections, through serendipity, through, keeping our ears to the ground, being open to new partnerships, and accepting of voices, and actually thinking a lot outside the box. Like Lachmi and I, and Leanne, who's on our team as well, have really thought about, outside of the box of the usual people that we connect with. Who else have we connected, or who else are we not hearing from, or what can we learn? And so keeping ourselves aware, I guess, and open to partnerships. Lakshmi, if you go ahead, please.
Yeah, maybe just to add, thinking about one of the most successful partnerships, is my working relationship with Sandra. And one of the things I think that has made this partnership so successful over the years, as she said, we've started with these very small grants that we used to the utmost of what we were able to do with it, and we just kept growing from there. Is having those shared ideas, and we are both such passionate educators, and wanting to do, always thinking about improvement, continuous quality improvement. That is at the root of what we're doing. How to create more opportunities, more pathways for to bring everyone along as we go. And we first connected not only through pharmacy, but also we are both first generation to attend this level of education within our families. That's something that is very core to our identity. And so I take this with me whenever I'm meeting, visiting another school, or, I'm always thinking about, so when I hear, I interact with folks and I hear interesting ideas, I think, oh, like right away, I start thinking about, oh, how can we connect, And I think Sandra hit on many important points. It's about the reciprocity of the partnership to make it successful. It cannot be one way. And that key to that is communication. And one of the things that, as we started to build out our grant writing, is to include remuneration for the time and expertise of our partners, and making sure that work is rewarded, because otherwise it can be a very draining space sometimes doing EDI work. So I feel that having that that ability to be able to for our working groups to say, okay, you've given up your time and your expertise, and one, because you love it, and two, but we're also able to give you something in return as well, to keep that partnership alive.
That's fantastic. Thank you both so much for those comments. I think, Lakshmi, just what you were saying about, sort of appropriate recognition, financial, maybe receiving an academic publication as part of the
Yeah.
team. There are lots of different ways to sort of recognize, people who are contributing lived and living experience in research, in education, and program planning. And so I'm just so happy to hear that, because I think that's an area where, here at the university, we're also still growing in how we can appropriately recognize that in different ways. It's a wonderful point. I'm going to just take a brief pause and just see if there's anyone online who would like to ask a question. You can put it into the chat. We are also a small group today, so if you want to use the raise hand feature, we can also work that way. I'll maybe just give it a moment, and if not, we did have an audience question submitted in advance, so I can lead up with that, but I'll just give folks a moment in case there's any burning questions. Okay, I'm not seeing any. So the audience question we received in advance was a really interesting one. To me, it sort of gets at perhaps even the longer term next steps for some of this work. The question is, how do we assess healthcare students on their ability to promote diversity and equity and inclusion within their practice and within their with their patients? And then are there opportunities to measure this actually as an educational outcome for entry to practice graduates? Yeah, I'll see what your thoughts are on that.
That's a fascinating question.
It's a good one.
I have not thought about how would we assess our own pharmacy students in their ability. I think I would really need to think about this, Annalise, some more in terms of how would we assess them within the practice labs, because there is opportunity there. But then we also have to build expertise within our faculty to be able to accurately assess students. And for those of you who have participated in the practice labs, there are literally a couple of hundred people involved in bringing those therapeutic cases to life. So I think we would have to learn about how to assess, but then also to train our faculty to assess, and then that perhaps could trickle out into our community of assessors when students are on rotations and then in practice. And I think the challenge there, that jumps out at me is we said, patients experience the profession through the health professionals. And so what we're trying to do is get, influence a diverse health professional pool that will be better equipped to meet the needs of our diverse population. And how would we assess those groups in actually achieving those outcomes? That I think we would really need to think through a little bit more. But I think the patients themselves would probably be best. Our patient simulated lab, the patient actors, they know how they feel when someone interacts with them. And they also have some insight into what the goals of the case are from a therapeutic perspective. And they would be able to speak to whether they think the students, through their activity helped them feel like, it generated a good feeling where they would want to go back to that healthcare provider and have their needs met. That's a really good question. I think that's something that we'll need to think about.
Yeah, no, thanks for those thoughts, Sandra. Lakshmi, do you want to build on that at all?
Maybe just one thought. Before we think about how to assess the students, I know shortly before I left pharmacy, I was involved in the curriculum renewal, and part of their curriculum renewal, there was an EDI working group, and Sandra and I were both a part of that. And it was about looking at all of the cases that come through for the medication therapy management courses, and we assessed them through the tool for assessing cultural competence training, looking at, making sure that the case scenarios are free of biases. They are, that they are representative of a range of the population as well, right? So I thought that was like a key first step, because before we can assess our students and how well they're doing, we have to make sure our materials and the curriculum is set up for that as well.
Yeah. Yeah, I think that speaks to me just to the reciprocity again of yeah, setting up faculty and staff to also have that assessment component built in, and the reflexivity to say, when we go to assess students, what are we assessing them on, and what are our gaps or biases that are maybe involved. Definitely. Well, that's great. It's a good question. So lots to think about, maybe.
Lots of things. Oh, Anne has her
Yeah.
hand.
Yeah, Anne, if you'd like to unmute, please feel free.
Thank you. Yeah, I thought I would raise my hand and speak rather than doing another long question. But the comment about EDI, and given how much criticism there has been about this, thanks to our neighbor down south, is there any threat to your program and how you've designed it based on that environment, the current environment?
A great question.
Yeah. Lachmi, maybe I can start.
Sure.
I was going to say, our funding is not, our current funding is not under threat. So that's important. Will our other, like, we have another large grant submitted that has ties to the US. So haven't really thought too much about that right now, other than probably, I don't know if it will happen. I don't know, and I want to say that we're committed to this work. Our faculty is committed through the strategic plan. Our academic plan is committed to this work. And so, I think that's always a possibility. There's no question. Like, we are conscious of that. And I think right now, extremely grateful that we're in Canada and not not in the US right now. But I think we're committed to the work, and our faculty has given us the green light for this. And the university, frankly.
Yeah.
Yeah. Lachmi,
I was just going to say the same, Sandra, that, the University of Toronto is very much committed in its institutional priorities to this work. And, we gather our strength from that, to move forward with this work. It is important work. We know this. I think you have to think about healthcare, with our Canadian context as well, right? And we know that, especially post-pandemic, our healthcare sector has been under a lot of strain. And, one of the things that we need to do is bring more young people through to the professions, getting them to know about all of the different health sciences, not just pharmacy. Of course, we always promote pharmacy, but there's nursing, there's dentistry, there's pharmacy technicians, care workers. Like, there's so many aspects to this work that is essential to the way we survive, right? So I think we have to keep the momentum moving forward.
That's a great comment. I completely agree, Lakshmi. I think, there's a lot of different spaces for roles and personalities as well within the health sciences, and just any opportunity to amplify that and make people feel like they have a home in those professions, I think is so important.
Okay. I think that is our goal, to make visible and to make it clear that we strongly believe and are working with intentionality to say that we believe that everyone has a role and a voice, and to center it that way, so that it would only serve us, I think, well, our population well. And it's in Health Canada's, quintuple aim. It's there, like, serving patients, serving the patient experience. It's all there, supported right from the top. So that's inspiring, I guess, is my inspiring and reassuring.
Yeah, I think so too. And we all need a dose of that these days. So
Yes.
it's well due.
Yes.
We are almost at 5 p.m. So I'm going to wrap this up, but thank you so much, Lachmi and Sandra, for sharing this very, very important work. I'm thrilled for the conference later this year. That'll be a really exciting next step to bring people together. And thank you everyone online for some really interesting comments and questions that hopefully give you a little bit more to take home and mull over as this work continues.
Thank you, everyone.
Thank you.
Thank you. Have a wonderful evening, and we'll see you next month for our CPE Speaker Series again.
Okay. See you.
Thanks.
Bye.